of just only 4 fewer opiate-related deaths. 4 is a lot to those families. But, you know, over there in Scioto County, see if I don't know if I have the numbers, 9.7, think about this, 9.7 million doses of opiates were dispensed in 2010, 123 doses for every man, woman, and child in that county. It's down 10%. That's good news, right? I mean, it's down 10%. Oh, what are you saying? Speak up.
We had a 17% reduction in direct overdose deaths and a 49% reduction in indirect.
Stand up. Tell them. Yell it across the room, please. Come on, tell them. We got to celebrate our successes.
I'm from Scioto County, and we have.
Elisa's the lady I was talking about. She's a. Come on, come here. Come up here. Hurry, come on. We don't have all day, Lisa. Come up here. Give me that microphone. I worry. When I give anybody a microphone, I know it's trouble. But go ahead. Come on, Sherry. Go ahead.
In Scioto County, we were lucky enough to have a very good coroner named Dr. Terry Johnson, who kept excellent records as a coroner, and later became our house rep. But so we were able to look at our deaths last year, and we had a 17% reduction in direct overdose deaths, and a 42% reduction in indirect drug-related deaths, compared 2010 to 2011.
Did you ever think we'd get there? Did you ever think, Sherry, that when we came down there as a team that we'd be back and back and back?
I absolutely knew that we would get there because you were on the way.
Well, it was all these people and the women and everybody else. That's great news. Thank you. Thank you for doing that. So, one of the things that we have learned is that we can only do law enforcement so much, and we can only intercept so much, and we can only treat so much. Never enough dollars for all the things that we would like to do. And we know that, right? We know that we have to get to the source of the problem. So in an unprecedented way, Greg Moody, who runs our health transformation operation, got together with what we call the 3 amigos here, Dr. Winslow and Bonnie Cantor-Berman and Orman Hall. And they went out and they approached the emergency rooms. And you all know about the emergency rooms and what happens in those emergency rooms. And the fact of the matter is, they were able to reach agreement with the emergency rooms to establish a protocol, guidelines, which they're going to describe in obviously much better detail than I can. And it is one of the largest access points for opiate painkillers. And we hope it'll be reduced to a trickle. Now here's what's really interesting. So there is a message to the people that work in those emergency rooms that we're here to help you, that we want to create a protocol that actually puts you in a stronger position to be able to practice medicine the way you want to, and not sometimes the way you believe you're being forced to. And at the same time, there's a message to those going into those emergency rooms. We're not giving you this stuff willy-nilly anymore. We're not going to allow you to get a prescription and go out and give it to your relative or give it to some kid or give it to anybody. Because we have reached agreement that these protocols will be established. Now here's what's really exciting about this. Not only did the emergency rooms be excited about cooperating with these protocols, but then the urgent care centers came in and said, can we help too? This is a big, big deal in this battle in terms of trying to stop things from where they are dispensed. And the work of Dr. Winslow and Bonnie and Orman made a significant difference by reaching agreement with the emergency rooms and the urgent care centers. They are to be complimented, they are to be complimented, and we should celebrate it every day that we're making great progress in limiting the dispensing of these drugs. I hope you would agree with all of that.